Hi, everybody. I am Dr. Lisa Sundin, and I am here today to discuss nursing leadership and political activism. And to help me do that, I have with me Mary Bylone, who is a registered nurse, a former chief nursing officer, and now a candidate for first selectman in a town in Connecticut called Colchester. Mary, thank you for taking the time to be with me today.
Thanks, Lisa. I'm happy to be here.
You've been a nurse for a very long time. I know you have a lot of experience, and now you're moving on to a political role. Can you tell me a little bit about that journey from practicing nurse to nurse executive and now onto politics?
Sure. Basically, I ended up in nursing leadership positions because as a staff nurse, I felt like people were making decisions about my nursing practice and they weren't including a nurse in the discussion. There really wasn't a lot of shared governance back in 1982 when I graduated nursing school. And so the way I thought that I could influence my profession and my practice was to take a formal leadership role. Mm-hmm. And so that's what I did in pretty much 30 years of my career. I spent in some type of formal leadership position in nursing leadership. Mm-hmm. I retired as chief nursing officer in 2015 and really was looking forward to spending my time with my 4 Newfoundland dogs and my family. And then what happened was the presidential election kind of spurred me on to make a promise to myself and to my son, my adult son, that I would make sure that in the future, that I would do everything possible to make sure the people that are elected represent the values that we hold dear. Mm-hmm. And so a few months later, a friend knocked on my door and said, "Hey, I'm going to this nominating committee meeting and I'd like to put your name forward for the Board of Education." And I was really ready to say no. And then I remembered my promise to my son. And I really do, I believe in that because I said I would. And so I said, well, I'd be interested to find out more about it. And I ran. I wasn't expecting to get elected. I did. And I have been happy as a clam on the Board of Education here in town because we have a phenomenal public education system here. But one thing I noticed is that the town really just wasn't moving forward. And I've really done a lot of work in my career around using your bold voice with nurses.
Yes.
Saying speak up if something's not right, or if you've got an idea, make sure you're there presenting that. And I thought, I need to live that. And so I thought to myself, what about that first selectman position? And so that's kind of what got me here. It's just a carry on of something that I've been working on for a long time around creating healthy work environments, mm-hmm.
Which
has a lot to do with nurses having the courage and feeling safe to be able to speak up when they think, they're to bring their value added to the conversation.
Great. So thinking about healthy work environments, you're sort of trying to do that now in a whole town. That's the work environment, right? So how do you bring that sense and perspective of health to the political campaign and to what you see as a vision for your town as first selectman?
Right.
Once you get elected.
That's right. Once I get elected. What I'm going to do is I'm going to talk from the perspective of the people that I speak to. When I've been door knocking for several months and out and about with the community. And what I hear from people is that they want things that can help them to be healthy. They're looking at our town and they say, we need more bike paths. We need more safe walking places. We need ways to connect. We have a beautiful airline trail that comes into our town, a spur that does. But there's no connection to bring them into the town to be able to have a nice lunch, maybe shop a little bit, spend some time on our beautiful town green to just get some rest and relaxation before, they head back out. So a lot of people talk about that. Certainly people talk about healthcare itself. Mm-hmm. That's really not so much a municipal, decision. However, we do have employees here in the town. So it's making sure that our employees have good coverage for their healthcare and looking at wellness activities.
So you're really talking about the social determinants of health.
Right.
And it's very interesting to me to hear you talk about that because you have that in your nursing background. And I'm wondering, you don't have to answer this question. We'll just put it out there that maybe other candidates don't think about that because they don't have that background, right? Or they don't think about it in as concise a way.
I think that's possible. I mean, I do think that health is something that seems to be on more people's minds now than before. And certainly one way for me to influence that is to role model it myself, which is not always easy when you're running a campaign and I was getting 8 hours sleep when I first retired, but I'll be honest to tell you that I'm not getting that anymore. But I do think it has to start with yourself, role modeling it, and then looking for opportunities where you can help your community to be able to achieve those goals as well.
Okay, so nurses are consistently voted the most trusted profession. Why are there so few nurses who are politically active?
Until 2017, I was one of those people. I will say this, though. I want people to think a little differently about what politically active means, right? So yes, I'm running for a position, and that's very visible. People can find ways to be politically active without putting their name on a sign and on the ballot, right? First, you can start with voting, right? That's the most important thing. So if I looked at it from that perspective, I've been very politically active because I have voted, and that has a lot to do with what my parents instilled in me about, listen, you have the right to vote, you get yourself educated about the issues, about the candidates, and then go vote. My parents never asked me who I voted for. They never tried to influence me, but they did try to influence the fact that I needed to be educated when I went to the polls. And so voting is political activism. And then other ways that, I started in 2017 was getting involved in the campaigns of others, learning what the issues were, finding people who represented the issues that I felt were important to me, and then supporting those people. So when I think about political activism or getting involved, I do like to try to stretch it a little bit to say there's not space for everybody to run for office, number one. But number two, I think we need to look at it in a broader perspective. But why aren't there more nurses running? I mean, the truth is we have trouble getting people to step forward for positions in general because people are afraid of the commitment. And quite honestly, sometimes it's controversial. You're putting yourself out there and you might take a hit from somebody, they're going to have something to say, and you're thinking, why bother? And nurses are busy people, and they're trying to do everything for everyone else, and sometimes don't take a pause to think about what would be important to them for themselves. I certainly would be that definition for many years of my career. So I think sometimes it's just that nurses don't feel like that's something that would matter or should take their time away from doing something else that they've decided is more important. I wish I could figure it out because I will tell you, I do mention to people all the time about nurses being the most trusted profession. And I have voted for nurses in my career that have run for political office. And they got my attention first because they were a nurse. And I have people at the door who say to me, "Oh, you're a nurse, I'm going to vote for you." And then they're a nurse, or their mother's a nurse, or their brother's a nurse, or somebody's an EMT. It's that bond that brings us together. Not are we a trusted profession to everyone else, we trust each other.
Right, exactly. And I really like your broad definition of politically active. I mean, have been very accomplished in your career. I know that you're retired now from the nurse executive role, but you've been very accomplished over time. And I would imagine that gives you some measure of confidence going into a campaign like this. But what about nurses who maybe are just starting out? Maybe they haven't even taken their NCLEX yet, but they want to get involved. You're saying that there are plenty of ways to get involved, and you take small steps and you build upon that, just the way you build upon your journey in nursing leadership. Would that be right?
Absolutely, yes. I think that the important piece is to get yourself educated so that you can make the best vote. That you get one vote, right? You want to make sure that it counts and it represents what's really important to you, because that's what should matter. So start by getting educated about the candidates that represent your own values. That's a piece right there. A lot of times nurses haven't taken the time to figure out what's important to them because they're so busy always taking care of what's important to other people. So some of what I've done in my career is working with nurses around self-care and self-awareness to understand what's really important to me, and that it's okay for me to make that important on my list, right? And so I think for you to be able to know what candidate best represents you, you do have to do some inner reflection.
That's great. I talk with my students often about self-reflection, understanding their own values, and then how that plays out at the bedside, and then in the larger sphere, in the environment, in their towns, and perhaps in a political way as well. How can nurses, and student nurses in particular, develop their political voices?
Well, I think the first thing is find a cause that's important to you. It doesn't, just because you're a nurse, it doesn't have to be related to nursing. It can, for a lot of people right now, it's the environment. A lot of people are really concerned about the environment. There's so many, it's so complex that there's probably a piece for every single person to be able to latch onto. For other people, it's about safety, and some of the things that have been happening in our country around, shootings and things like that. So find something that, because you want to start with something that you do feel some passion about. Because again, you're going to be putting yourself out there. So find what that is. Maybe it is nursing related. Maybe it is about making sure that the people have access to healthcare, or, women's rights, or, related to healthcare, those kinds of things. But find something that's important to you. Get educated on the topic. And then it shouldn't be too hard to find some venue to be able to start to use that voice. It may just be one-on-one with a friend. That you sit down and you say, hey, I've been reading articles about this such and such, and I'm concerned about this. And, what could we do about it? How do you feel about it? And so then all of a sudden, next thing you know, besides just your friend, now you've got a few people. Maybe it's a conversation that you use as a starter, when you're in a party or in a social gathering. But I think that's the place that it starts. It's not about you're getting signs and you're walking in a picket line and, or you're getting yourself on the news channel at 6 o'clock. It really starts, it's all about the building the relationships and finding other people who think like you.
Right. And I suppose also joining nursing organizations is a good way to get involved with some of the issues that nurses in particular are fond of or are important to them.
I'm glad I feel bad I didn't mention that initially. I will tell you that something that really did touch me was I was in a group, actually at Quinnipiac, and we were having a discussion, and there was a woman there who was a nurse who was a lawyer, and she was doing legislation work. And I kind of thought to initially, I thought to myself, gosh, that's like not nursing. And then she started helping us to understand in the room that, decisions are going to get made about nursing practice, about what nurses do, who else can do what nurses do, with or without us. Those decisions are going to get made. And what her job was, she was constantly scanning the environment for these types of bills that were being brought forward to make sure that, oh my gosh, like that's not going to be good for patients. And then mobilizing, people to be able to, that are experts, to be able to speak on that, to help to educate the people who would vote yes or no for that bill. So the truth is, if we go back to why I went into management in the first place, that was an incentive for me to leave bedside nursing, which to this day would be, I was a surgical trauma ICU nurse. I loved the sounds of the machines and taking care of patients that were really on the brink of death. That was thrilling to me. To go into management and basically walking away from that, I needed something that was really important, and it was that motivation that came from somebody making decisions about medication administration times. That's actually what it was about. Without a nurse, without this, not talking to the person who actually administers the medication. So take that on to the next, a much higher level. If we don't engage and pay attention to what's going on, people are going to make decisions about regulating our practice, and they may not be in the best interest of patients. And that is, as a profession, that's what we're all about.
Exactly. And you bring up something very important, and I don't even know if you realized it, but you're talking about different levels of policy work. So you have practice policy, the medication administration records, right? We have local policy, we have state, national, and global policies, right? So there's a place for everybody.
Everybody.
Along the continuum, depending on your interest, your passion, where you are maybe in your own professional journey and how confident you are. And you take those, I hate to say it, but maybe baby steps along the way. So I'm glad that you brought that up. What do you think are the most important topics politically for nurses to be thinking about right now?
Well, I definitely hear all about, access to healthcare.
Yeah.
People are worried about that. I mean, I'm going to be 64 years old. So certainly I think about, Medicare. It's in the news all the time. And those of us, when I worked in the hospital, I get to see firsthand, right? We see as nurses firsthand what happens when people don't have good access to healthcare, and they finally come when they're so sick, because they haven't been able to, afford to go to a primary care doctor or have any preventative health done, or they can't afford their medications. So I think that that's a huge pressing issue. And I do hear it from people when I'm having meetings with them. And although it's not something that we really regulate at the municipal level, it is something that's concerning to me as an individual, but also if I'm going to represent the town, right? All the people that live here, and we do have a lot of seniors. And it's not to say that it's only senior people that have to worry about access to healthcare, but that's certainly one of the really loud voices of people who are saying to me, what are we doing about this? So I think that there's lots of opportunity around access. I think some of the other things are women's health issues, and certainly making sure that there's access and understanding for our LGBTQ population as well, because there are some inequities that exist there. And then really research certainly is an important part. So there's, finding money, getting people to pay attention to some of the things that maybe don't get the attention because they're not the big thing that everybody's, talking about. And then maybe, just trying to think, look at the opioid issue.
Right.
That's real. That's in every town. No one is escaping that.
Right.
And I certainly think that nursing plays an important role in that, in making sure that we're educating our patients well when they're in the hospital, because a lot of the opioid addiction happens right there under our care.
Right.
And then also we've got nurses in the schools and they're dealing with it. Now there's vaping that's becoming an issue. So I think that there's a lot of opportunities to find something related to healthcare that would really benefit from nurses' voice being involved at the table.
That's great. And you also earlier mentioned environmental health. I mean, there's, I always say if it's a problem and it involves humans, then it eventually has an effect on health. So go for it if you're interested in it. I know I also talk with my students about writing health policy memos to legislators. If there's something that's on your mind that's important to you and you want them to pay attention to it, that there's a process for doing that. And I work with one of my classes to learn how to do that. Do you recommend that for students, say, or even other nurses if they have, if they're not going to get involved directly with a problem, should they be writing to their legislators? Should they be writing to their municipal leaders about these problems to bring awareness to the problems and hopefully have the direction and the wherewithal to address them?
I think all students should be doing it. Honestly, I received letters from Bacon Academy high school seniors. They were, it was an assignment that they had to write to somebody. And most of them wrote to somebody who was currently elected. But there were 10 of them that sent me letters. And I think like 9 of them were about the environment. And one was about the safety. Safety issues, because we do the drills in the schools and things like that, and that was concerning to them. But I'll tell you, I hand wrote a response to each one of those students, and I was really impressed that, high school seniors took the time. Granted, it was an assignment, but they got to pick the issue and the person that they were going to write to. And I thought, they picked me, I owe them some type of a response. So yeah, I really think any student, it would be good to do. Pick something that's important to you and write to somebody about it and see if they write back,
Mm.
or if they pick up the phone and call you, whatever that response might look like.
I'm sure those students really appreciated hearing back from you.
I did have a couple that did reach out to me to let me know,
Did
but
they?
the rest of them, yes, most of them I didn't hear anything from, but I did have a couple that said, thank you. And quite honestly, I would expect that they might be asking me about what I'm doing for those environmental issues. What a group of them had done is they collected all the plastic we have 4 schools here in our town, from elementary through high school. They collected all the plastic out of the trash for one day. They piled it up and took a photo of it. They weighed it, they counted the pieces. And some of them included that data in their letter, right? And so I would imagine that once I'm elected, they'll be coming to find out, what am I doing about that?
Yeah, sure.
So,
and they ought to. That's great.
Right. And they'll probably have my response that said, yes, I think this is an important issue, so hold me accountable, which is what they should do.
Well, we're just about out of time right now. What's your takeaway message to nurses and nursing students about political activism?
I think it's a great opportunity to be able to use your voice. And, there's no reason, honestly, there's no reason not to speak about what's important to you. If, sometimes people say to me, well, I'm afraid to speak up, or I don't know what to say, or how do I get invited to the table? And what I'd say, if those are some of the things that run through someone's mind as to why they're not doing it, there are plenty of us out here that have been exactly where that person is. And now we can be mentors to those people. And so the same as I would hope that they would do that to someone in the future. But yes, I mean, we need more people speaking up and engaging. In this town of 16,000, there are 11,000 registered voters. In our municipal election, we'll be lucky if 3,000 of them turn out to vote. 3,000. They will make decisions that will impact their taxes, will impact when the roads get plowed, what technology is able to be purchased in the schools for their children, and less than 3,000 people will show up. So to me, that's people that there's their opportunity. That's an easy way. I mean, it's a secret. Nobody even knows how you vote, right? There's an easy way to use your voice, and it's passed up by so many. And so I would just encourage people to get involved, find something that's important to them, get involved with it, get educated about it, and then speak up about it.
Great. Well, Mary Bylone, thank you so much for your time and best wishes in the election.
Thank you very much.